Hello everyone. Today we're going to look at the apple cider vinegar test. This apple cider vinegar test can be done to test for low hydrochloric acid or stomach lining damage, which a lot of people have. I see it a lot with my clients. A lot of acid reflux, and people just think it's normal, and it's definitely not normal. Any sort of acid reflux is a red flag and shows there's some sort of problem going on with your gastrointestinal tract. So the apple cider vinegar test is something we can use here, and I know everyone's going to be so excited because everyone loves apple cider vinegar, and this is just another way for us to get it into your day. But this can be a really helpful test to help you understand what is causing the acid reflux. I must give you a disclaimer though, this test can be an indicator of what the problem is, but you may need to still go to your health practitioner for further tests if you do suspect damage or infections are at play here. So how this works is if you have regular heartburn or acid reflux, one way to get an idea of where you are is to do the apple cider vinegar test, which sounds really, really fun. So what we would do when you have acid reflux, and even if you don't have acid reflux, this test can be helpful with the correct kind of body awareness and sitting with yourself and just kind of feeling how it feels when you take apple cider vinegar. This can help you sense or feel if your stomach is working and or if there's a potential issue. So this can be done at any time, but for those who experience regular heartburn or acid reflux, the next time you get heartburn, you're going to take 2 tablespoons of apple cider vinegar. Now you can just shoot this or you can mix it with some water if you want, but it has to be 2 tablespoons minimum of apple cider vinegar. And then you're going to monitor what happens next to your reflux symptoms. If your symptoms do go away, that can indicate that your acid reflux is caused by low stomach acid or hydrochloric acid, or HCl as you might hear it referred to as well. So if the symptoms do go away, that's going to be telling us that your acid reflux is being caused by low stomach acids. So then you need more acidity to get rid of your symptoms. So more acidity into your diet, kind of signaling to the body to make its own acids and hydrochloric acids before meals. So if this is the case, then you can take apple cider vinegar before your meals, or lemon juice will work, and even other vinegars before a meal. Alternatively, you can take a hydrochloric acid supplement. It'll say HCl, and usually it'll say betaine HCl or HCl and pepsin. Or you can take some digestive enzymes, which a really good digestive enzyme, well, most of you know at this stage that I love now super enzymes. They will contain some acids of some sort in there. Maybe they'll be bile acids or stomach acids. They'll still help. And you would take these 5 to 10 minutes before a meal, just to give it time to settle into your stomach and really signal to the body, like, let's make more ourselves as well. But on the other hand, if you take apple cider vinegar and your symptoms get worse, or you feel like burning or sensitivity, or you'll know if something's off, that's an indicator that you may have some tissue damage there, maybe a pre-ulcer or an actual ulcer. And in this case, you'll need to prioritize healing that tissue or the lining of the stomach first. You'll also want to go see your physician at this stage to make sure that you don't have some sort of H. pylori infection. So H. pylori, it's pretty easy to get exposed to. Most people who have low stomach acid for some other reason, stress or whatever, they're at higher risk of getting a H. pylori infection, because when the bacteria comes in, they don't have the stomach acid to kill it off, and stomach acid is one of our lines of defenses. Like, we get exposed to bacteria on cups and our hands and everything all day, every day, and it's up to our stomach acid to basically neutralize that and kill it. So if you do have low stomach acid and you get exposed to this bacteria, Then H. pylori, the bacteria shape in itself is like a little screw, like a screwdriver, not a screwdriver, a screw. So it'll drill into your stomach tissue, and it'll drill right in there and bury itself in there, and it'll multiply, and it also forms a biofilm over it. So it's eating into your stomach tissue, which then causes that ulcer to happen. So if you take apple cider vinegar and your symptoms get worse, you are going to want to see your physician and ask to get tested for H. pylori. So if you do have this bacteria or an infection, then you may need an antibiotic or something to get rid of it first, and then start the healing process. Otherwise, you may just have an ulcer from stress or a poor lifestyle, and you just need to heal that. So a few things I like to heal are mastic gum. I love mastic gum. There's a really good one I like to use. I can't remember the brand, but it also has Saccharomyces boulardii in it, which is a good yeast. So just in case there is a bacteria issue, the mastic gum will come in and help the healing, but that yeast will help fight off any bad bacteria. Good yeast is great that way. It'll fight off bad bacteria as well and displace it. And I like marshmallow as well. So you can get marshmallow root tea, because sometimes people don't want to take lots of supplements. So I like to pair the mastic gum with the marshmallow tea, and that usually works really well. And even for acid reflux, mastic gum will just stop acid reflux almost immediately, and then you continue to take it, it continues to get better, and at the same time you're healing whatever is happening there. Then you can also try DGL, which is diglyceride licorice, which has many studies supporting its efficacy as an anti-inflammatory and for helping to heal your stomach. So if you do some sort of a healing protocol for 2 to 3 weeks, which would also include reducing sugar and alcohol and avoiding toxic fats and oils, so your greasy foods, your trans fats, any kind of oxidized oils, you want to avoid them completely, or as much as possible. Then after those 2 to 3 weeks, you can try the apple cider vinegar again. And if you tolerate the apple cider vinegar, then you know you're on the right path, like you're on the way to healing your stomach. And then you would just continue with those healing supplements or whatever you're using, and slowly reintegrate the apple cider vinegar, monitoring how you can tolerate it. Whatever direction this test takes you, it's very important that you reflect on how did you get the low stomach acid in the first place, or how did you get the damage? Couple of questions I would ask is it chronic stress? Is it poor lifestyle habits? Because movement as well is very important for producing enzymes and acids in your body. Like, do you have a sedentary lifestyle? Do you have poor nutrition? Maybe it's a brain injury, because that will affect stomach acid production. And that will also affect vagal nerve function, or maybe you just have poor vagal nerve function since you were a child. Maybe it's hypothyroidism, because that will slow down the production of stomach acids and enzymes. Maybe you have chronic inflammation, or it could just be age and genetics. Whatever it is, once you reflect on it, I'm pretty sure you'll be able to narrow it down and come up with some sort of answer yourself. And then once you do that, reach out to your health professional or whoever's kind of helping you on your health journey and say, like, this is what I think the cause is. How can we address it and prevent it from happening again in the future? Because just because you fix something doesn't mean it can't come back in the future, because it totally can. I hope you guys found this helpful. If you do try the apple cider vinegar test, let me know what your results are. What did you find out? How did you feel? How did your stomach feel? I'd be happy to give feedback as always. So I hope you found this helpful. Please share with anyone that you think would benefit from this, which is probably a lot of people, because a lot of people have acid reflux and stomach issues. So that's it, guys. Have a great day, and I'll chat to you soon.